Hi, welcome to pediatric surgery. This is a multidisciplinary field that encompasses many surgical specialties. The specialty includes the care of a child from neonate to late adolescence, but we're going to see all different sorts of services and different sorts of specialties involved in the treatment of these children. Most pediatric procedures can be classified in one of three groups. Surgery for treatment of congenital anomalies, and that means that this was a condition that developed during fetal life. Also, procedures for treatment of disease, and then trauma surgery. Care of the pediatric patient is unique. Children don't act like adults, no matter how hard they try sometimes. Their psychological responses are different. For instance, children are scared and they'll show it. Where adults may be scared and most often are scared, but do a pretty good job of hiding that. With those different psychological responses, we want to make sure we treat them carefully. You see in this picture here, just a hand on the head or gentle eyes, assuring the child that they're going to be okay. There are also very different physiological responses that we have to pay close attention to in children. One of those physiological responses, the difference between children and adults, is thermoregulation. So why are pediatric patients, and especially infants and neonates, vulnerable to hypothermia and hypothermia? Well, their physiological mechanisms that normally regulate temperature in adults are absent or undeveloped in the infant. Infants and children tend to lose more heat than they generate. They have extensive peripheral circulation that contributes to rapid cooling, and they also have insufficient insulation. When an infant is cold, brown fat, which is only found in infants, is metabolized. This uses up oxygen and glucose. The result is hypoxemia and hypoglycemia. Electrolyte balance is disturbed, and this can lead to the loss of intravascular fluids in the skin. These are serious complications that we have to be aware of, and why we take thermal regulation so seriously when it comes to children. Steps to maintaining the pediatric patient's temperature are implemented throughout the entire perioperative period, not just in the operating room. During transport, neonates may be placed in a warmed isolette, as you can see right here. This is an infant-sized bed that is temperature and environment controlled with the ability to monitor vitals. You can see down here vitals being shown. During surgery, several methods are used to maintain the core temperature. I'm sure you've noticed if you've done any PEDS cases, the pre-warmed operating room. It's hot in there. Something you definitely get used to if you're working in PEDS. You can use a warm air blanket cautiously. We want to be careful for burns. Overhead lighting and solution warmers are also some examples. Fluid balance means we are maintaining the correct amounts and types of fluids in body spaces. Infants can become dehydrated rapidly, so maintaining a fluid balance is important. An IV line is a crucial component for PEDS and must be established before surgery begins. This can actually be a pretty tricky procedure, which may require your help. Sometimes anesthesiologists need just a little bit of assistance during the IV placement. Those little veins are sometimes very difficult to find. Pediatric airway is definitely different than adults and something that has to be taken into consideration. One of the most important anatomical differences between adult and PEDS is this respiratory system. So, failure to manage a pediatric patient's airway is among the leading causes of death in medical and traumatic emergency. There are many important features of the pediatric anatomy. The tongue is in large proportion to the oral cavity. Infants less than 8 weeks breathe through their nose, so if that is blocked in any way, it could cause respiratory failure. The trachea is much smaller and shorter. The airway is delicate. The thoracic wall is weak, and the lung capacity is much lower. Much of the pediatric surgery is performed to correct structural or congenital defects that develop during fetal life. The cause may be inherited or genetic, or it could be an acquired abnormality. The most vulnerable period in fetal life is in the first 60 days. An environmental agent, a chemical or drug that injures the embryo or fetus, is called a teratogen. Certain infectious agents are also known to be teratogenic. The following infectious microorganisms cause significant congenital abnormalities. I want you to take a look at these. You can also see them in your book. These are important to know. Whatever it takes for you to memorize, if this means making flashcards or using Quizlet, I would like you to know each of the microorganisms and be able to match them with the congenital abnormality. Congenital and genetic abnormalities. You'll see in your book in Fuller on page 9, 11, and 12 a long list of congenital and genetic abnormalities, conditions. I want you to make sure that you can match these conditions with their description as well. Pediatric patients may be given an anxiety-reducing medication before surgery. Parental presence during induction is now an accepted practice in many health facilities. So one of the, this kind of depends. The medication depends on a couple of things. So if the parent does choose to come into the operating room, sometimes that will take the place of the necessity of that preoperative med. If a parent is unable to, that medication will help soothe the child before entering the operating room. The method of induction depends on a few things here. The age of the child, is there IV access, and is a parent present, as we talked about. Skill of anesthesia sounds rough, but the truth is a lot of anesthesiologists don't have a ton of peds experience, and they'll be very open and honest about that because it's so dangerous for the child. So a lot of times a group will have one or two anesthesiologists who are more comfortable or more practiced with children. A factor involved in induction is that ASA status of the patient. Because of their small size and undeveloped organ systems, pediatric patients are at high risk for adverse events from improper medication. Pediatric medications are prescribed according to the child's weight in kilograms, and the correct dose must be verified by the surgeon, circulating nurse, and scrub. If you are at all unsure of the med that you have on your back table for that baby, make sure that you check it multiple times. There is no such thing as checking too much when it comes to children. Finally, pediatric instruments. You'll notice there is not a pediatric instrument presentation. There will not be instruments on the test this week. Pediatric instrument sets are assembled for each specialty, such as cardiac, genitourinary, or gastrointestinal surgery. The instruments themselves may be smaller in dimensions, or only the tips or working end might be smaller. Mosquitoes are used often, and really, honestly, anything that has that fine tip. So it'll be like there's a small baby Balfour that you see there. Everything is just shrunken, made a little bit smaller.